Welcome to NSTP2. So we will now proceed with the module number 2. So at the end of this lesson, you must be able to first review the Philippine health situation, second, conduct a research on the current health condition in your community, and third is to develop an action plan that is applicable to the current health condition in your community. Okay? So with this module, ayan ang matatakal natin dito is more on the health situation natin, the current health situation dito sa Philippines. Bakit kailangan natin tong alamin? Syempre with that, alam na pag naintindihan natin at nalaman na natin yung current health situation, malalaman din natin kung anong klaseng tulong or paano tayo makakatulong with the health situation. Okay? With the current health situation. Not hindi naman sa kabuuan but as simple as with the current health situation within your community. Mas madali nating malalaman kung sa paanong paraan na tayo makakatulong. Okay? So, the Philippine health situation at a glance. So, discuss natin yung 10 facts about healthcare in the Philippines. So, with this, tingnan natin kung ano-ano nga ba yung lagay na ng health situation sa Pilipinas. So, the World Health Organization or WHO labels a healthcare system as well-functioning if it provides impartial access to quality healthcare regardless of pay dimensions while protecting them from financial consequences of poor health. Healthcare in the Philippines does not meet these set standards. So basically, ang goal nitong World Health Organization is magkaroon tayo ng easy access pagdating sa health needs, okay? But sabi nga, sa Philippines, hindi natin yan nami-meet. Alam naman natin yan, di ba? So, first fact about healthcare in the Philippines. So, the World Health Organization refers to the Filipino healthcare system as fragmented. There is a history of unfair and unequal access to health services that significantly affects the poor. The government spends little money on the program, which causes high out-of-pocket spending and further widens the gap between rich and the poor. So, sa inyo, ano ba sa tingin ninyo? Totoo ba na merong unfair and unequal access to health services? Totoo kaya? Unfair daw ba talaga and unequal pagdating sa Pilipinas, pagdating sa healthcare services? So, that would depend sa inyong mga experiences. But kung titingnan natin sa mga balita, di ba? So, sa balita, hindi ganon ka-easily access sa mga mahihirap, 'di ba? Hindi ganon kadali para sa kanila pag maka-avail ng mga healthcare services, 'di ba? Lalo na yung mga may health needs, 'di ba? Napakalaking gastusin pagdating sa mga mahihirap. Hindi ganon ka-fair ang treatment, 'di ba? So, totoo naman na it significantly affects the poor. So, syempre, kapag mahirap, 'di ba? Hindi ka ganoon kadali makaka-access sa mga healthcare services, 'di ba? So, syempre, napakagastos niyan. Hindi naman ganoon kayayaman ng lahat ng mga Pilipino, kaya hindi lahat 'yan na-avail, lalo na yung mga kailangan. And then, second fact is out of 90 million people living in the Philippines may do not get access to basic care. The country has a high maternal and newborn mortality rate and high fertility rate. This creates problems for those who have especially limited access to this basic care or for those living in generally poor health conditions. So, kung dito sa atin sa urban areas, 'di ba? Maaaring tayo may easy access pagdating sa ganyan, yung mga healthcare services ng government, 'di ba? As simple as pagpunta sa health center, 'di ba? Pwede ka nang maka-avail ng mga free healthcare services sa health center. But to think na meron tayong mga areas na hindi naman ganun naaabot ng mga healthcare services, lalo na sa mga probinsya, yung mga nasa bundok, walang mga health workers na maaaring makatulong, kaya hindi rin nakakarating yung healthcare services ng government, di ba? Kaya sabi nga, ayan, Out of 90 million people living in the Philippines, many do not get access to basic care. So yung mga nasa mga liblib na lugar, sa mga nasa probinsya, ayan, wala talaga silang access pagdating sa ganyan. Kailangan pa nilang bumiyahe ng malayo, lalo na kapag may mga emergency purposes, di ba? So, totoo rin naman. And then the third one is many Filipinos face diseases such as tuberculosis, dengue, malaria, and HIV or AIDS. These diseases pair with the protein energy, malnutrition, and micronutrient deficiencies that are becoming increasingly common. So totoo naman na pagdating di ba nga pagdating sa HIV and AIDS yan, marami na mataas talaga ang rate niyan, mataas ang cases niyan dito sa Philippines. And then also yung iba pang mga sakit, 'di ba? Kung mapapansin niyo in the previous history sa mga news, 'di ba, nagkakaroon ng mga different outbreaks. Yan ngayon, meron tayong pandemic. So, aside from that, marami pang ibang sakit na mga naglilipa na ngayon, lalo na sa setup natin dito sa Pilipinas. Then the fourth fact is the population is affected by a high prevalence of obesity along with heart disease. Okay? So, ayan, karamihan talaga, ayan, sabi nga, karamihan ng mga nagiging cases ay yung, yan, mga heart disease due to obesity. Diba? Ayan, kaya ingat-ingat kayo pagdating sa ganyan. Okay? And then next is healthcare in the Philippines suffer from a shortage of human medical resources, especially doctors. This makes the system run slower and less efficiently. Totoo naman, 'di ba? Na kakaunti talaga mga health workers natin dito, especially doctors. Bakit nga ba nagkakaroon ng ganon? In my own point of view, ayan, kaya supposedly marami naman talaga dapat, pero mas pinipili ng mga nagdo-doctor sa atin or yung mga health workers na magtrabaho na lang sa ibang bansa kaysa dito sa Pilipinas. Bakit? Kasi mas malaki ang sinasahod sa ibang bansa kumpara dito, di ba? Minsan kinukurakot pa, kaya imbis na mapunta para dapat sa mga health workers, kung saan pa napupunta, di ba? Kaya mas nagkakaroon tayo ng shortage pagdating sa mga human medical resources like nurses and doctors and other healthcare workers, di ba? So, totoo rin naman. And then next is Filipino families who can afford private health facilities usually choose this as their primary options. Private facilities provide a better quality of care than a public facilities that lower income families usually go to. The public facilities tend to be in rural areas that are more rundown. These facilities have fewer medical staff and inferior supplies. So, sabi nga, yung mga families na medyo mga hindi naman naghihirap or nakakaangat-angat naman, mas pinipili pa na mag-avail ng mga health services sa mga private institutions or sa mga private facilities like mga private hospitals, 'di ba? Mas pinipili nila na doon na lang mag-avail kasi nga mas quality yung service na ma-avail nila with that compare sa mga public healthcare facilities, mga public hospitals, hindi ganoon kaganda ang service. Bakit hindi ganoon kaganda ang service? Kasi hindi naman maaari na hindi sila well-funded or maaaring well-funded pero hindi na ma-manage ng maayos or hindi na ilalaan ng maayos yung dapat na paglaanan, 'di ba? And then maaari rin na nakaka-affect din sa kanilang pagpo-provide ng service is yung in-earn din nila na hindi naman ganun kalaki kaya hindi nagiging ganun kaganda yung kanilang service. Unlike sa mga private institutions na kung saan nababayaran sila ng maayos, malaking kinikita nila, kaya maganda rin yung service na naipo-provide nila. Okay? So, yun ngang mga mahihirap, mas pinipili na lang sa public, pinagtitiisan na lang kung ano yung meron, 'di ba? Kaysa naman pumunta sa private, mahirap na nga sila, 'di ba? So, Yun po. And then next is only 30% of health professionals employed by the government address the health needs of the majority. Healthcare in the Philippines suffers because the remaining 70% of health professionals work in the more expensive privately run sectors. Okay? Bakit nga yun? Mas mas madali kasi makapasok, and then at the same time mukhang mas naaalagaan ang mga health workers pagdating sa private institutions kumpara sa government. And next is to compensate for the inequality, a program called Doctors to the Barrios and its private sectors decided to build 9 cancer centers, 8 heart centers, and 7 transplant centers in regional medical centers. So, not sure with this. So, sabi nga, facts nga naman ito about healthcare in the Philippines. So, meron daw tayong, doctors to the barrios. Pero hindi pa rin naman lahat ng barrios ay may mga kanya-kanyang doktor. Tulad sa amin, rotation pa rin ng doktor. Hindi siya yung full-time kasi nga may shortage pa rin tayo. 'Di ba kung mapapansin niyo sa mga health center, mga public 'yan, public health center, 'di ba? May kapag pupunta kayo diyan, may schedule yung pagpapa-check up sa different na concerns ninyo. For example, sa pagpapabunot ng ngipin, dati hindi naman araw-araw pwede yung bunot sa health center, 'di ba? May mga specific na araw lang, sabihin natin may na-encounter ako diyan parang every Wednesday lang or MWF or TTH lang. Bakit? Kasi yung doktor, hindi lang naman siya permanente doon. May iba pa siyang area na pinagjujutihan. Okay? Kaya nagkakaroon ng rotation. So, though meron tayong ganitong program na tinatawag na Doctors to the Barrios, insufficient pa rin. Okay? And then yan, meron daw binild na 9 cancer centers, 8 heart centers, and 7 transplant centers in regional medical centers. Then the 9 is the Doctors to the Barrios included public-private partnership in a plan to modernize the government-owned hospitals and provide more up-to-date medical supplies. Ayan, may public-private partnership na daw sa pagdating sa ganyan sa pagpo-provide ng health services. So, maaaring ang pinoprovide na maaaring yung mga doctor to the barrios na yun, hindi lang yung mga doctors coming from public hospitals but also from the private institutions na kung saan maaaring ang nagpa-fund doon ay yung government, and then nagpapapunta lang ng mga doctors. Parang another extra income na rin yun sa mga doctors from private institutions. And then the last one is more than 3,500 public health facilities were updated across the countries. So, though meron na tayo yun yan, 3,500 public facilities, hindi pa rin sapat. Okay? Mas marami pa rin nangangailangan. Actually, nakakakuha niyan mga nasa urban areas talaga, but in rural areas, problema pa rin yung ganyan. Okay? So, yun po yung 10 facts about healthcare in the Philippines. Now, let's proceed with the Philippine government responses to the COVID-19 pandemic. So, ano nga ba yung ginawa na ng government in terms of the COVID-19 response? Okay? Let's proceed. Yan, Philippine government responses to the COVID-19 pandemic. So both the national government and local governments have responded to the COVID-19 pandemic in the Philippines with various declarations of emergency, closure of schools and public meeting places, lockdowns, and other restrictions intended to slow the progression of the virus. So first and foremost, ang naging response ng government pagdating dyan, ayun ng pagkakaroon ng lockdown. If I'm not mistaken, that was March 17 last year, nung nagsimula yung lockdown, 'di ba? Lahat tumigil ang mundo, 'di ba? Sabi nga ni Moira, at tumigil ang mundo, 'di ba? Nawala ng pasok sa trabaho, sa eskwelahan, yung mga biyahe tumigil, 'di ba? So, yun yung naging first move. But before that, before pa nagkaroon ng lockdown, many people urges the government na magkaroon na ng travel ban as early as January. 'Di ba? Bago pa makapasok yung virus, marami na nag-urge sa government, marami na nag-react most especially pagdating sa social media, 'di ba? Na magkaroon na ng travel ban. But then ano ang sabi? Palakasin daw ang immune system natin. O kaya baka daw masaktan yung mga Chinese friends natin kapag binan daw natin ang nagkaroon tayo ng travel ban against them. Okay? Up until end ng January, mayroon nang naging case na nakapasok dito sa Philippines. And then after that, mga ilang cases pa, tsaka lang tayo nagkaroon ng travel ban. At nung nag-search na nga, dumami na nga, nagkaroon na ng community transmission. Ayan, doon na sila nag-decide na magkaroon ng lockdown. At ilang buwan tayong na lockdown, di ba? So, yan, part yan ng COVID-19 response. So, during the lockdown period, syempre maraming nawalan ng trabaho. So, different local governments, ayan, sabi nga, di ba, merong naging responses ang both national government and local government. So, sa different LGUs, 'di ba? May kanya-kanyang naging paraan or nagkaroon ng different ways kung paano masusupport ang mga tao, 'di ba? So, in Quezon City ba? Sorry, hindi ako taga Quezon City. Ano ba yung naging responses dito ng LGU ninyo? Nagkaroon, 'di ba? Nagkaroon ng pamimigay ng mga groceries, 'di ba? Na yung iba parang house to house pa, door to door pa ang delivery, 'di ba? Not sure kung ilang beses dito. Sa amin, in Valenzuela, nagkaroon kami ng 3 rounds ng pagkakaroon ng pagbibigay ng grocery supplies. Okay, tawag doon mga food pack na naka-box. So 3 times nagbigay ng ganun. Wherein yung isang box is nagiging good for good for 1 week sa isang family. Okay? So, yun. Then, yun yung naging pinaka-common na naging response or naging action ng mga local government. But for the national government, nagkaroon ng financial assistance through DSWD, di ba? Yung tag dito, yung basta yung ayuda na nakuha, kung hindi ako nagkakamali, 8,000 yata sa first tranche. So 8,000 yon. Then aside from that, meron pa nakuha ayun yung pala yung kay DSWD yung SAP, yung Social Amelioration Program, di ba? So that's the part of the response ng national government. Aside from that, yun pang provided ng SS, 'di ba? May nakuha rin yung other employees na mga nawalan ng trabaho na assistance from SSS, 'di ba? Meron din nakuha from DOLE. Okay? So part 'yan ng responses ng national government. Okay? So again, combine nga both national government and local government ay nagkaroon sila ng response with the COVID-19 pandemic. Okay? And up until now, yung pagkakaroon ng pag-acquire ng vaccine, yan, part din yan ng responses, okay? Not only the national government, di ba kung mababalitaan ninyo sa news ngayon na ang government is nag-acquire ng ganito, tapos mababalitaan ninyo yung mga different local governments nag-acquire din sila, di ba? So, yan. So, next, Bayanihan to Heal as One Act. So, this is the first na part ng COVID-19 response ng national government. So the act would allow President Duterte to reallocate, realign, and reprogram a budget of almost 275 billion from the estimated 438 billion national budget approved for 2020 and in response to the pandemic, enable him to temporarily take over or direct operations of public utilities and privately owned health facilities and other necessary facilities. When the public interest so requires for quarantine, the accommodation of health professionals, the distribution and storage of medical relief, and facilitate the streamlined the accreditation of testing kits. So basically dun sa Bayanihan to Heal as One Act, ayan, ito more on the COVID-19 response na sinabatas para mas mapadali yung ating pagtugon sa pandemic. So inilaan yan sa mga quarantine facilities, sa ating mga healthcare workers, di ba? So, yun po ang content nun or yun nilaman nung Bayanihan to Heal as One Act. And if I'm not mistaken, nasundan pa yan. Diba? Meron pang Bayanihan 2. Okay? Hindi ko na matandaan kung may 3. Kung nagkaroon pa ng 3 yan. Okay? And then, universal healthcare. The Philippine Health Insurance Corporation announced that it would provide 30 billion worth of advance payment to its accredited health facilities for healthcare providers to obtain the liquid capital required to efficiently respond to the crisis. PhilHealth also subsidized some of its policies on its members. It waived the 45-day coverage and single period of confinement policies while extending payment deadlines until the end of April and failing periods of claims from 60 days to at least 120 days. Also, PhilHealth announced that PUIs quarantined in its accredited facilities are entitled to a 14,000 health package, while those who tested positive for COVID-19 are entitled to a 32,000 pesos beneficiary package. So, di ba meron tayong PhilHealth? So, tag dito, sa mga nagtatrabaho na naghuhulog naman ng PhilHealth, po pwede yung ma-avail. Ang tanong, paano naman kung hindi member ng PhilHealth? 'Di ba? So, wala nang access doon. So, gastusan ninyo 'yun. Sabi nga napakamahal magkaroon ng sakit, 'di ba? So, with that, may responses na ginagawa ang national government and local government with that. Pagdating sa ganyan, syempre magastos talaga 'yan, 'di ba? So, sa amin in Valenzuela, since mahal nga ang magpa-test ganyan, so ang testing sa Valenzuela lalo na sa mga una nilang pinrioritize is yung mga naging PUI before or persons under investigation na kung saan with that free yung testing. Okay? Kasi nga kung i-shoulder yan ng mga tao, hindi nila kakayanin dahil nga mahal. At mas pipiliin pa nilang wag na lang magpa-test para hindi gumastos, di ba? So, part ng response ng local government na sila magfa-fund for that. Okay? So, again, going back with PhilHealth, di ba? Paano yung hindi members, di ba? So, maganda yung benefits as in okay, na may makukuhang na entitled with different benefits, okay? Paano kung hindi member, di ba? So, yun. And then, next is mass testing. As part of the national government's effort to conduct mass testing, it began setting up mega swabbing centers in May 2020 by repurposing various existing facilities. The first of such facility opened at the Palacio de Manila along Rojas Boulevard on May 5. These facilities use reverse transcriptase polymerase chain or reaction or RT-PCR kits. The facilities are meant to prioritize the testing of around 25,000 OFW repatriates. 2 more facilities opened at the Enderan Colleges in Taguig and the Mall of Asia Arena in Pasay. So as of September 2020, the Philippine government has reported that over 3 million people have been tested. So mass testing, issue pa ito nung kasagsagan ng lockdown. Parang ayaw pa ng national government na magkaroon ng mass testing. Sabi pa nga nung isa, there's no such thing as mass testing pa daw. And then lately, na-realize ni Pangulo na importante pala ang mass testing. So, bakit nga ba importante itong mass testing? Kasi, mas nakokontrol yung pagkalat ng virus, di ba? So, test, then pag nag-positive, isolate. Okay, with that, mas nalilesen yung pagkalat ng virus. Kaya importante yung mass testing before, di ba? So, up until now, continuous pa rin naman na mass testing. Siguro kung mas napaigting pa ang mass testing before, siguro mas bumaba na yung cases natin ngayon. Pero, decision na nila yon. Ayan. And that ends our module number 2.